If you have both a sore throat and chest pain, the symptoms could be unrelated. They could also be an indication of an underlying condition such as asthma, gastroesophageal reflux disease, pneumonia, lung cancer. Keep reading to learn more about conditions that involve a sore throat and chest pain, along with how they're diagnosed and treated. Asthma. Asthma is a respiratory condition that causes spasms in the bronchi, the main airways into your lungs. Typical symptoms include coughing, most often when exercising, and laughing, and at night chest tightness, shortness of breath, wheezing, most often when exhaling, sore throat difficulty, sleeping. According to the American College of Allergy, Asthma and Immunology, ACI, 26 million people are affected by asthma. Asthma treatment. For asthma flare-ups, your healthcare provider may recommend short-acting beta agonists, such as albuterol and levolbuterol, ipratropium, corticosteroids, either oral or intravenous. For long-term asthma management, your healthcare provider may recommend inhaled corticosteroids, such as fluticasone, mometasone, and budesonide. Modifiers, such as silutin and montelukast. Long-acting beta agonists, such as formoterol and salmeterol. Combination inhalers with both a long-acting beta agonist and a corticosteroid. Gastroesophageal reflux disease, GERD. Gastroesophageal reflux disease, GERD, occurs when stomach acid flows back from your stomach into your esophagus, the tube that connects your throat to your stomach. This reflux of acid irritates the lining of your esophagus. Symptoms include chest pain, heartburn, chronic cough, trouble swallowing, regurgitation of food and liquid, laryngitis, hoarseness, sore throat, sleep disruption. Treatment. Your healthcare provider may recommend over-the-counter, OTC, medication, including antacids, such as Tums and Mylanta, 2 receptor blockers, such as famotidine, and cimetidine, proton pump inhibitors, such as omeprazole and lansoprazole. If medically necessary, your healthcare provider may suggest prescription-strength H2 receptor blockers or proton pump inhibitors. If the medication isn't effective, they may recommend surgical options. Pneumonia. Pneumonia is an infection of the alveoli, air sacs, in your lungs. Common symptoms of pneumonia may include coughing, possibly producing mucus, rapid, shallow breathing, shortness of breath, fever, sore throat, chest pain, typically worse when inhaling deeply, or coughing, fatigue, nausea, muscle pain. Pneumonia treatment. Depending on the type of pneumonia you have and its severity, your healthcare provider may recommend antibiotics, if bacterial, antiviral medication, if viral, OTC medications, such as aspirin, acetaminophen, and ibuprofen. Proper hydration, humidity, such as a humidifier or steamy shower. Oxygen therapy. Lung cancer. The symptoms of lung cancer often don't appear until the disease is in its later stages. They can include chest pain, worsening persistent cough, coughing up blood, shortness of breath, hoarseness, sore throat, headaches, loss of appetite, weight loss. Lung cancer treatment. Your healthcare provider will make treatment recommendations based on the type of lung cancer you have and its stage. Treatment may include chemotherapy, radiation, surgery, targeted therapy, immunotherapy. Clinical trials. Palliative care. Diagnosing a sore throat and chest pain. When you visit a healthcare provider for a diagnosis, you'll be given a physical examination and asked about symptoms beyond your sore throat and chest pain. Following this evaluation, the healthcare provider might recommend using specific tests to zero in on the underlying cause of your discomfort. Recommended tests may include complete blood count. This test can detect a wide range of disorders including infection. Imaging tests. These tests, which include X-rays, ultrasounds, and magnetic resonance imaging, MRIs, provide detailed images from inside the body. Sputum test. This test can determine the cause of an illness, bacteria or virus, by taking a culture of the mucus coughed up from your chest. Pulmonary function tests. These tests can diagnose and determine treatment by measuring lung volume, capacity, and gas exchange. Takeaway: if you have both a sore throat and chest pain, visit your healthcare provider for a complete diagnosis. These symptoms may be an indication of a more serious underlying condition.